name is Reagan Sandifer. Today I want to talk to you about why healthcare workers should get the flu shot each year. Because people go to healthcare facilities to get better, not to get sicker. Unless you have never watched the news or read the newspaper, most people know that this year has been one of the worst flu seasons in the past decade. The flu is a virus that can be deadly, but can be prevented with a simple annual flu vaccination. The flu epidemic has caused many healthcare organizations to make the flu shot mandatory for their healthcare workers. However, many of these healthcare workers disagree with the policy of being forced to receive the influenza vaccination. Healthcare workers should receive the influenza vaccination because their jobs are to help patients get better, not get them sicker. Also, healthcare workers who choose not to receive the flu vaccination can lead to absenteeism due to them getting the flu. Influenza can be a very serious illness and in certain populations can be deadly. Each year, influenza kills 36,000 people in the United States. This is why the U.S. Centers for Disease Control strongly recommends all healthcare workers get the flu shot. Most patients enter into a healthcare setting usually for one of two reasons. They are either sick or they are having a procedure performed. Regardless of the reason for their visit, patients do not expect to be exposed to the infectious healthcare workers. Most patients enter the healthcare setting with the expectation that they are going to get better. However, the potential for flu exposure does exist, especially if the healthcare worker providing their care has not received their annual flu vaccination. Patients could end up getting sick or sicker, which could increase their length of stay in the hospital and increase their recovery time. Many patients with the flu have had to be put on ventilators to breathe and to stay alive. Not only do infectious healthcare workers pose a risk for their patients, they also pose a risk of exposing each other to the flu. An influenza outbreak among healthcare workers can lead to the issue of not having enough staff to provide adequate care to patients. Lack of appropriate staff can result in errors being made and poor quality care being given to patients. Also, some workers make the poor decision to come to work regardless of being sick and expose their co-workers and patients to their illnesses. There is also the concern of spreading the illness to their families as well. This is one of the things you don't want to share. Many people believe that the flu is a short-term illness that will resolve itself in less than a week. For most people, there is a reasonable expectation. However, for the young and the elderly, the flu can lead to some serious conditions, such as pneumonia. For those with chronic conditions, such as diabetes, lung disease, or heart disease, death may actually result from exposure to the influenza virus. Most of us believe children to be healthy and able to overcome most any illness. However, the flu can be serious or deadly in this healthy population too. No one is immune from catching the flu. Some people believe they will get the flu from the flu shot, but this is not true because it is a dead virus. Healthcare workers do not want to be the reason for their family members, patients, or co-workers from getting sick, or even possibly dying. Therefore, healthcare workers have a responsibility to take care of themselves while at the same time protecting their patients. Other than issues such as allergies to eggs or certain chronic conditions, the influenza vaccination is completely safe. Healthcare workers getting the influenza vaccination is very important for helping prevent the spread of the illness. Vaccination is the best way to not only to protect the healthcare worker, but to also protect their families, co-workers, and patients from getting the illness. So go get your flu shot because I am, and I'm afraid of needles. Thank you.